So this talk is about gallstones, which is a very common problem in our country. Hi, I am Dr. Madhusudan. I am a surgical gastroenterologist and liver transplant surgeon working at Apollo Hospital, Madurai. I would like to enlighten the audience what is actually gallstones and what do we need to do once we are diagnosed with gallstones. See, gallbladder is a small organ that is situated below the liver. The size is around 5 to 6 centimeter and it stores somewhere around 60 to 70 ml of bile every day. The only function of gallbladder is to store bile, and bile is secreted from the liver. The purpose of bile in a human body is to help digestion, and there are several other functions, but for practical purposes it helps digest a fatty meal that any human being is going to take. So if there is a dysfunction with the gallbladder, like if the gallbladder is not moving well, if there is any alteration in the bile secretion, the bile physiology, then the bile is going to stagnate within the gallbladder, and over a period of time it can form gallbladder stones. So there are two groups of patients where it is quite common. One will be female patient who is in her 40s and who is little bit obese. So fat female patient in the 40s is a very common group of patients in whom gallbladder stones can form. Second group of patients will be male with uncontrolled diabetes. So these are the second group of patients where gallbladder stone can form. So gallbladder stone can form in patients with uncontrolled diabetes. So this is also another thing that we have to keep in mind. So once we are diagnosed with the gallbladder stone, should we go for surgery upfront or should we delay it? So this is a question that is quite common in people's mind. So I'll just try to help you in understanding the problem. If you have a gallbladder stone and you have constant pain in the tummy, like upper part of the abdomen, more on the right side. If there is a constant pain in the abdomen, especially after a meal, especially after a fatty meal like oily food, then most likely the gallbladder stone is symptomatic, and it is always better to have a surgery for gallbladder stone. Second reason why we should have a surgery is, while most of the gallbladder stones are diagnosed by an ultrasound, if the ultrasound shows the gallbladder is already inflamed, there is stone that is migrated down to the common bile duct causing jaundice. So these are all the indications for getting a surgery done. So mostly the gastroenterologist will be able to decide whether we need to go for surgery or we can wait and watch for some time. So this is how we decide on the surgery. Second, what surgery will be done in these? Almost always gallbladder surgery will be done laparoscopically. It is by a small keyhole incision that we place the port, and then through the ports we put the instruments and remove the gallbladder. It's a surgery that takes 45 minutes to 60 minutes maximum, and the patient can get the surgery right on the day of admission, and they can plan for discharge in a day. The next day after surgery, discharge can be done. This is fairly straightforward surgery. Of course, the surgical team will be very meticulous while doing the surgery, but in general, after the advent of laparoscopy, this is a fairly straightforward surgery, and it can have a very early discharge. And patients can really feel the difference after the surgery. Once the gallbladder is removed, their abdominal symptoms, most of them gets disappeared, and they can have a they can enjoy a good meal. All the problems that they had in terms of pain will be settling. Other common question everyone asks is, if we remove the gallbladder, anything else is going to happen to the digestive system? Absolutely nothing, because gallbladder, as I told earlier, is only a storage organ, and it stores a very minimal amount of bile. So even after removal of the gallbladder, the storage function will be taken care of by the liver, which will store much more bile than the gallbladder. So removal of gallbladder can be safely done, and I would advise, if a surgeon or a gastroenterologist asks you to have a surgery done in a given situation, it can be safely done. Thank you very much.